Hello there and welcome to another lesson. I hope your preparation is going on very smoothly. In this lesson, we are looking at a sample OET speaking, and for this, it's for nurses. Although the speaking is profession specific, what we are about to do should be helpful regardless of your professional background. For every task card, you're given the setting, the scenario, and then your task. The setting, the scenario, and the task. What you have on the left is for the professional, for the nurse, and the one on the right is for the interlocutor who is acting as a patient in this particular test. So let's begin to analyze what we have. The setting is the same. Like we can see, both are in the hospital ward. Let's look at the nurse's scenario. You have been called to the patient's bedside. The patient is a 37-year-old man or woman, depending on the gender of the interlocutor on the day of the test, who was admitted to the hospital yesterday with a fractured leg. You notice that he or she looks quite agitated. It's early morning and the doctor is on rounds in the hospital. He or she was given a painkiller earlier today. Now the patient, you are 37 years old and were admitted to the hospital yesterday with a fractured leg. You're in a lot of pain which has not subsided despite the painkiller which was given to you earlier. You rang the buzzer 30 minutes ago, but no one has come to see you. You feel alone in the hospital and the pain is making you very uncomfortable. This is the first time you have been hospitalized. You are annoyed with the hospital staff for neglecting you while you were in pain. You realize there are similarities and what you have for the nurse and the patient are complementary. So while the nurse is dealing with a 37-year-old man or woman, like I said, depending on the gender of the interlocutor, the patient is 37 years. So you realize the correspondence between the two. Now let's move on to look at the tasks assigned to them. I must say that the nurse, at the point of taking the test or acting her role play, is not aware of what the interlocutor has on his or her task card. You don't know what the interlocutor has, but always have it in mind that what you have is complementary to what the patient has, and that will help you to really structure the consultation very well. And remember, it is your test. So you're supposed to take the initiative of organizing and structuring the consultation that would go on. This is not different from what you do in a daily basis at your workplace. So you shouldn't find any difficulties whatsoever taking care of this. Now let's look at the task. The nurse is supposed to find out why the patient is angry. The patient is supposed to tell the nurse agitatedly that he or she is extremely upset and wants to file a complaint. The nurse is to explain next that he or she was attending to a critical patient, and then empathize with the patient regarding his or her complaint and calm him or her down. You realize that the next task of the interlocutor or the patient about answering questions would necessitate the nurse to ask questions, which is not stated explicitly on the task card. But as it is your job, and you have to make sure that you gather enough information from the patient, of course, it's logical that you understand why the patient is angry to help you deliver on your job as a nurse taking care of that patient. Then next, after the questions and answering on the questions from the side of the nurse, and then the answers from the patient, the nurse is to ask him or her about the pain, whether ongoing pain relief medication is effective, and the pain, you need to put it on a scale. For example, or on the scale of 0 to 10, can you tell me the level of the pain? Then for you to ask whether the pain relief that has been administered so far is effective. Remember, you're not supposed to ask compound questions, and so these two should be asked in different instances. The patient is supposed to tell the nurse that the pain is on a score of 11, and so they need a stronger painkiller. Then next, the nurse is supposed to let the patient know that they would have to call the doctor to change his or her pain relief medication, and the patient is supposed to demand that the nurse does the prescription and not the doctor, because he or she is seeing that as another delaying tactic. The nurse would have to come in to address what the patient has just said. Then the patient will move on to ask about the whereabouts of the doctor. The nurse would have to respond to that, although that has not been stated expressly on the task card of the nurse. In the previous lesson, we looked about what she's supposed to do with the responses of the patient. You're not just supposed to listen and leave it at that. You're supposed to respond to that. You're supposed to react to that. So you need to do that appropriately. When that is over, the nurse is supposed to find out if the patient has any other concerns, and the patient is supposed to let the nurse know his or her dissatisfaction with the hospital food. Related to that, the nurse is supposed to encourage the patient to discuss his or her dietary preferences with the hospital dietitian. You realize that the tasks are complementary. So whatever you have to do to elicit the necessary information as a nurse, you have to do. And your questions and your encouragement will make the patient give you the information that you're supposed to get from them. This is what is happening on the day of the test, and it's good that for this analysis you understand the role of the interlocutor as well, and this would prep you, this would help you so that on the day of the test you know what exactly to expect. Of course, it's about asking questions, receiving responses, responding to the responses, asking the next questions here and there till the whole thing is over for both of you. Best of luck in your preparation, and I'll see you in the next lessons.